Good afternoon. I'm Dr. Steve Boorman. I'm a specialist occupational physician. That's a doctor that specialises in the relationship between work and health and how health impacts on work and how work can actually in turn impact on an individual's health. I'm the Chief Medical Officer for Capita PIP, and in 2009 I was invited to lead the independent review of health and wellbeing of NHS workers to look at the relationship between NHS staff health and organisational outcomes and patient outcomes, more importantly, at the end of the day.
Many of the problems that student nurses report to occupational health are often to do with stress and what might be described as psychological difficulties or mental health difficulties, often invisible. Mm-hmm. What do you suggest student nurses can do to recognise those problems, and also what can they do to deal with them?
I think the simple message is to not be afraid to recognise those problems. The simple fact is that in the general population, actually mental health problems are actually very common. 1 in 6 of us will actually have them. So the first thing is don't try to hide it. Don't be afraid to admit it, and don't be afraid to actually seek help, either from student health or from a GP or from other health services.
Student nurses are in a very different position from employed nurses. They're often working in hospitals where they're not employed, and whether the trust doesn't seem to have any responsibility for them. What do you think? How do you think they should deal with that isolation?
Okay, well, I mean, I think there are many ways of actually answering that question, but the first thing to say is that a trust does have a duty of care to those students just as much as it would have a duty to a contractor that was working on their premises. So there is a duty of care there in the first place. But I think actually students should be self-aware and should understand the sources of help that they can actually go to when problems actually arise. Be that back in the university that actually is the organisation that has given them the placement, be that community services, or be that services in the trust that they're actually placed in.
What can student nurses expect from an should they expect from an occupational health department? Should they have to visit one or consult one? What should they expect?
Well, unfortunately, one of the things that I found back in 2009 was actually quite a negative perception of occupational health. There was a bit of fear and a bit of trepidation, and people often had a sense of being sent to occupational health as potentially a punitive thing. Good occupational health is about providing confidential, clear support and advice both to the person who is ill in the first place and then to either their employer or the people that are actually managing their programme of education at the end of the day. So they should expect confidentiality, they should expect good quality advice both at a personal level but also to help them understand what the impact of their health condition is likely to be on their future study and then also on their future employment going forward if it's going to be a long-term problem. So trust it.